I have found our patients to be extremely resilient in that they are not giving up on their own hope for the possibility of living a sober, well, healthy life. Even though the world is rapidly shutting down and changing around them, that the structure and consistency that we offer for their recovery has not changed.
Being able to engage people in treatment and still staying connected is one of the biggest pieces of successful recovery. When things are shut down and there's less resources, people feel like they're isolated. So being able to still provide services through telehealth allows people to recognize that they're not alone and that there's other people too that are struggling.
At the time that this all hit, I was 9 months sober and I was looking for work. I think without the support of telehealth and seeing my counselor and being a part of that would make this a whole lot harder, because my counselor's been super validating that we are in a pandemic. It is not your fault you can't find a job. This is not because of your previous alcohol and drug use. This is unprecedented. And I just needed to hear that. And I just needed to really hear that. And it gives me some structure throughout this whole thing. Whew, that is life-saving treatment for people.
I'll probably remember this date for the rest of my life. March 23rd is when the Oregon Health Authority and Multnomah County, and really the Tri-Counties, advised that we move towards telehealth for community health and wellness. And one of the things that really stood out to us is that no one has any education or specialty skill set or training in providing telehealth. So we really focused on how we can continue to build on the relationship that already existed in individual sessions and be reviewing treatment plans during the session.
I think not having a lapse in terms of jumping straight to telehealth, okay, here's what we're doing next week on Tuesday, as opposed to, we don't know what we're doing, I'll call you. And there was quite a bit of confidence on the side of my counselor DePaul in terms of here's what we're doing next.
DePaul for me definitely stands out for other treatment centers that I've been to because of I'm not just a number, I was a person, I was a human, and now I've been an outpatient for over a year. And with COVID happening and having to do telehealth, this has been interesting, but I still feel that same warmth and that same support that I've had even being there in the office or being there in inpatient.
So some of the benefits for telehealth for family therapy is that family members get to engage no matter where they're at. So if long distance was a factor where they weren't able to come into family therapy, long distance is no problem now. Another benefit of telehealth, especially using Zoom, is that I can share my screen. So any YouTube clips, anything that I want to share for resources, I can share my screen and the patients automatically get to have that information right in front of them.
Family therapy with Megan has been absolutely wonderful. My fiance was laid off for COVID, and it's been hard as far as depression for him, and she can get to a level with us that we both can connect back together, and we can, even off the phone and after we're done, we can remember the tools that she's given us. And she even told me that we can reach out to her no matter what. Even if we don't have a session set up, we can always find a time to meet with her, and she would be right there for us. So it's been wonderful.
We created what we call the COVID TLC board, which is our COVID Tender Loving Care board, and made a list of all those patients that we knew going into this change were more vulnerable to drifting out of care and to not engaging in treatment, and do outreach. And so by outreach, I mean physically showing up, knocking on their doors, offering any resources they might need, such as food boxes. Care Oregon was able to give us a few temporary phones, and so offering them phone services if that's something they don't have access to.
I am most proud of not only our patients for adapting to something that's really hard, but I'm also really proud of DePaul's staff who has worked together to make sure that we're still providing adequate services to people struggling, and we did not shut down our business, although the world shut down.
With the outpatient team, I tend to quote Mr. Rogers a lot, that wherever there is crisis, look for the helpers. And I take a lot of pride in the fact that the outpatient team, along with all of the direct service staff at DePaul, have voluntarily said, I'm going to have an attitude of helpfulness and be a helper during this time, and use the skills that we know our community so desperately needs more than ever right now.